Welcome to Between Two Clinicians, the podcast that gives you a backstage pass into the mind of two therapists. I'm Talia.
I'm Adam Luke. We've spent years helping others navigate the complexities of their minds and relationships.
In this podcast, we're flipping the script, and we're sharing our own unfiltered insights. No topic is off limits, and no issue too taboo. We're ready to tackle the tough stuff with honesty and empathy. Let's dive in. Hello, and welcome to another episode that is a part 2 of Between Two Clinicians. I am one of your co-hosts, Talia. I have with me
Adam.
And today we will be continuing our discussion from our previous episode, what it is like to hold the frame and have boundaries and structure in therapeutic relationship, in the career and the profession at large, and what often happens when those boundaries are questioned, pushed upon, the limits of which are explored. So as a review, last time we spoke about the frame of therapy being the necessary paperwork, obviously, that gets signed, whether that's electronic or in person. That's part of the frame of the what to expect out of this process and this relationship. Then the frame of the clinical room or the Zoom room that you're in, there's a specific session day and time, typically, if not the same day every week. There's a session amount, right? 45 minutes, 50, 55 minutes. We will meet X amount of times a week or a month. There's those kinds of setup of the frame of here's when we meet and what it's going to look like and how we meet. And then within those meetings, here's what you can expect of me. Here's what I expect of you. And we were just talking off air, and it came up for me in my other role as well, and one of the other roles I have as well, when clients push back, when there's an enactment of what they do in their own personal life that is likely in part leading them into the treatment in the first place.
Absolutely.
They respond and react and interact with us the way they are doing with the problematic that they're experiencing in their life. And it comes through in the clinical frame. It comes through with pushing back on cancellation fees, the entitlement, of expecting an exception. Wow, you guys are really, staunch on the rules. It's like, well, yes, like we have not only legal and ethical limits and guidelines for our licensure. Each business has its own policies and its own informed consent that you signed. And here's your IP address signature of when you signed it. That is not on me that you did not read it thoroughly before signing it. It is on me, however, to make sure I review before we really dive into anything. Hey, saw that you signed this. Any questions? As a reminder, I am a mandated reporter, which means anything you say in the room stays in the room unless you let me know about child abuse, elder abuse, dependent adult abuse, at which point I will have to involve the necessary authorities. I would not go behind your back and do that to the best of my ability because I do not want to rupture the trust in our relationship. Other than that, anything you say in the room is confidential, aside, again, from if you let me know you're going to hurt yourself or somebody else. So those are, I'm more eloquent when I say that, but those are the known structures that it's good to say in the first session, just in case the person didn't do it. And within the rapport, meaning the relationship and the felt sense of closeness that is built between the therapist and client, there are times where clients will push the boundaries. There are times.
Absolutely. Like another way of sort of encapsulating everything that you just said there is you've basically defined what your scope is.
Yes.
So like it's very important as a therapist to know what your scope is. It's very important as a client to know what is the scope of therapy.
Yes.
Because therapy is not a one size fits all sort of thing. There's only areas that I'm going to be able to work in. And I think that that's where a lot of clients struggle at times is because they try to stretch that boundary of like, what is therapy? How can I apply it? And at times, let's be honest, we're coming to therapy. We've got heightened emotional states where we've got grief. We've got whole complex spectrum of emotions that we're navigating. And so then when we're met with a boundary or a certain rigidity on like, hey, this is actually the scope of what we can do. I can't actually help you in those others. We want to sit there and say, well, why won't anyone help me? Or, what am I paying you for?
Right.
And that's one of those situations where it's like, well, you're actually also paying me not to do you harm. Like what you're asking me to do is actually it's not my expertise, and I could be 75% wrong, but I can be 25% wrong. Like, I don't know, like, how this is going to be, right? And to your point, like, it's interesting. If you hired anyone to come over and work on your house, and you're like, hey, we really want to have whatever feature in our house, and someone said, oh yeah, I can bid on that, and you're like, okay, so that's your specialty, and they're like, oh no, that's not my specialty.
No, I'll just
Would you, like, I'm sorry, what?
Yeah.
Like, huh? Like, I don't think you're going to go with the guy that's like, oh yeah, I saw that once. Oh, have you ever done it? No, I've never done it. Is it something that you specialize in? Oh no, I don't have the skills.
Right.
Like that's where, as a therapist, I don't feel bad when someone steps in and asks me of something that's like, that is not my scope.
And their scope of practice, which is, this is for most every field, obviously, and I'll make it specific for therapy. Scope of practice, what is the area and areas and the topics covered under your scope of practice? The practice being a licensed marriage and family therapist or therapist in training. Here is the scope of practice. Here is what you are allowed and not allowed to do within this license. So even if you have extra education or another certification or another degree, when you're acting under this license or in this scope of practice, those are not allowed to come in. You could have a 10-year career as a personal trainer, shift and become a therapist. A therapy client could ask you about fitness advice, and that is not in the license, like LMFT scope of practice. You can, within the ethics, make a referral out to, that I actually do have a lot of expertise in that, but that's not what you're coming in to see me for. But because I know other people in that realm, here would be the referrals that I would make, or here's a helpful web, like .com. Here's a helpful website that you can create your own workout plan. That might be the only like knowledge, but I'm not then going and saying, and then let me write it for you and let me hold you accountable. That's out of your scope of that practice. Competence is a whole other scope. Just because I'm licensed as a marriage family therapist, and let's say, which is the truth, LMFTs, when trained and certified, are allowed to practice these specific modalities: EMDR, IFS, DBT, CBT. Just because my license would allow for it, if I don't have the right training, that's not in my scope of competence. Treating eating, treating infidelity, treating substance use, treating high acuity care. Just because my license allows for it, technically, if I'm not trained in that or seeking consultations and certification, I am not, that is out of my scope of competence to be treating that specific client. So knowing that, I know this sounds jargony for people sitting there listening who aren't in therapy or therapists. We have some listeners. What does your career allow you to do, and where are you skilled at? Is the well put. It. I cannot then expect, and this is where things go south in the rupture that I want to touch on, that clients will push boundaries. Sometimes it is not a intentional push. We don't know what we don't know. You're coming into therapy saying this thing, great. I believe you. I would hope you kind of know the truth. That's a whole other episode for clients who come in live consciously. I am a high achiever and I'm really stressed out by my job and I want to come to see you because that's your specialty, Talia, whatever it would be. Okay, my specialties are confidence and assertiveness, which how I just described this client, that fits. If along the way they're like, and I also have this history of abuse and I want EMDR, I'm not trained in that, I'm going to refer out, and I have an eating disorder and I have an active drinking problem, that's not what you came to me for. If this gets disclosed and covered along the way, which often happens because we don't know what we don't know, the ethical thing to do is make the referral out so the client can get the help. The problem becomes when the client feels, validly so, from their perspective, why can't you help me with everything? And they're not really
feeling punished for telling you what I tell you this and then you're leaving me. Right. So there are like abandonment things that we have to look at as clinicians. I think that there's also like, realize that when something like this pops up, like we can equally be bummed out, like where it's like, like, man, we've made such good work, but ethically, legally, I can't help you in that regard. I'm not the one to bridge that gap, but we've done so much work that at least you've seen that therapy works.
Yes.
That therapy is actually something that can benefit you. So if you made this much progress with me, imagine what happens when we find someone that is their special.
And we don't always have to stop. That's, I think, learning to pitch as a therapist, our marketing and sales side of things, learning to share with them, I need to be honest with you, these
Yes.
these things that have come up, we need a second set of eyes, and I can still be seeing you, right? Because I don't do EMDR. If I'm referring out for that, depending on what we're covering in the sessions and if they're using insurance or not, obviously a few caveats, we can be seen concurrently. I can see them for this topic and this scope. The other clinician who's trained in whatever it is that I'm not, or the reason I'm referring out for, even if I am trained in it, I don't want to double dip sometimes and try to do that. I want a different perspective. We can then collaborate, and it feels more containing for the client that they have frames going on. And there are other times where simply because of what's coming up, it would be contraindicated for me to continue our work while they're in whatever else it might be. That could be EMDR, IOP, substance use, eating disorder. We might need to pause our work so you can, the client, continue your work with this referral.
Absolutely.
When completed, we can come back and resume with a more whole psyche to keep down that path. And sometimes clients perceive that, rightfully so, as you're abandoning me. Why are you not enough? Why can't you be that? Analytically, the way I help clients work through that is to understand and try and ask them to vocalize. Does it feel disappointing that you came in hoping this would be a panacea or a cure-all or a final savior or whatever it might be, and that you're not receiving that? And where else have you experienced that pattern, going to somebody expecting help and they let you down? So we still do the work. Usually comes from parental disappointment or early childhood disappointment.
For sure.
That isn't still going to cure or solve if they have substance use concern or something else. So both, and we can continue the work, and there are times where there might need to be a break in our frame, or we call in another contractor metaphorically, and we're like, we need 2 frames for a while. Like, this supports
and what a great way, like, so when you actually build a house, there's a framer, and there's a finished carpenter. So like is there crossover? I guess. I mean, they both have hammers, but they're very different in what they do.
There's a blueprint.
So, exactly. Like, pull in the engineer or the architect. Like, this is actually something that we've dealt with before in many other ways, right? Like, you wouldn't go to your PCP to ask them to cut the cancer off of you. I need to go to a specialist. Same thing with this. It's just interesting because sometimes when we've become extremely vulnerable with one person, we then get stuck in this loop of like, well, I don't want to leave you.
I don't want to tell my story to somebody new that you know everything about. All valid and so worth validating for the client. I can only imagine how frustrating this feels to be told, you kind of need to say it 1 or 2 more times, or we needed to tag in. This is where us holding the frame, collateral consent, doing a release of information. I'm happy to give them a call and share my perspective. It's still not going to take the place of your story, but if it would help you to feel a bond with them that I fill in, so there's not as much to share, happy to do that if you'd like. And then there's other people who are like, I'm not signing that. I don't want them to know what I talk about in here. Okay. Can't force an ROI. Very telling though sometimes of how the client is like, well, I only want this help here. It's the control piece of it too. Right. With individual and couples work, I have some couples who are like, we're both an individual. Here's the release from the first get-go. Like, please call and consult. I'm open for feedback, share whatever. And then there's others who are like, you're not touching, not literally, obviously, you're not getting to my individual therapist. What I say here stays here. You said that in the first session. Like, you don't need to ask them. Sometimes it does come out later on. And I'm oh, well, this makes sense why they didn't want to share that, because it is a really dynamic pattern that could get in the way of couples work. And this isn't, I want to be very clear for anyone listening, this is not coming from a place of judgment. Your individual therapist, like, wow, they're so that, no, but there are times where that context, and I talk to another outside observer and their perspective, we only know what you tell us in the frame. If you are knowingly omitting things to look good or fake a certain persona, or you're just not thinking it's relevant to share, right? It runs the gamut. This is very helpful for us to know so we can better help you. But if you have a pattern of withholding certain information because you don't want to be seen a certain way through real life outside of the therapy room, that's probably going to come true in the frame as well. This is where that boundary piece, clients push those boundaries. Well, I didn't think you needed to know that. Well, I kind of do need to know you're drinking a 30 rack a night if we're planning on like, and it's not a judgment, right? I'm not saying that.
Whoa.
It's like, that's kind of, I think I'm going to deem what's important information or not for the therapy because I'm the one writing the treatment plan with you, right? Like, and if I'm writing this treatment plan without knowing these two things need to be included in it. Hey there, listeners. Are you tired of settling for less than you deserve in your relationships? Do you ever feel like you're not being seen, heard, or valued the way that you want? Or maybe you've been wondering why you keep attracting the same kinds of people into your life, or why certain patterns seem to repeat themselves in your relationships. The answer might be deeper than you think, and you can find it in my new course. Rewire Your Relationships is a transformative course designed to help you stop settling for less than you deserve and start embodying your most confident, assertive, and authentic self in your relationships. You'll explore how your early experiences and parental influences have shaped your views on love, dating, and self-worth. This isn't just about tips and tricks for dating. It's about understanding the core beliefs that drive your relationships that you attract. You'll learn how to break free from those old patterns and start creating the kind of connections that truly reflect who you are. Imagine stepping into a relationship with clarity and confidence, knowing you're attracting people who value and respect you for who you really are, your deeply authentic self. The Rewire Your Relationship course gives you the tools to rewrite your relationship story, one where you're no longer settling, but thriving. Visit taliabombola.com/rewireyourrelationships or check the link in the show notes for more.
I mean, going back to the house analogy is really helpful in this. Like, we're hiring you to build a patio cover. Well, I still need to know blueprints of the house. So you don't need to know blueprints of the house.
No, you don't.
The house looks like it's about to fall over. We want a patio cover. Like there is this.
It's just going to collapse. Didn't you see this wood rot? I didn't tell you to look down there.
Exactly.
Okay.
and so that also normally comes out in the initial session on whether or not we're going to be a good fit.
Yes.
If because I'm also like, if you're going to essentially put up an electric fence around where I can go clinically,
right,
then from the get-go, we're really not open to the process.
Yes.
Like, and so I've told people, like I've had people come in and sit down and say, hey, I don't want to go into my childhood. I've had something bad happened. I have trauma that I've never talked about. I don't want to start there. And I've always said, don't start at the 10-10s. When you're starting therapy, don't go for the hardest part, right? And I think that comes with the wisdom of having sat with so many people, because when you're first out of school, you're like, all right, give me the boss level issue and I'll take care of it. And then that's just it's a very chaotic approach, and it's not necessarily putting your client first in that moment. It's like, oh, you want to slay the dragon, you don't necessarily want to hear what this person has navigated. But I will often tell people, like, okay, that may not be where we start, but I need you to be open to, as we continue to sift, if we keep on getting redirected back to that period of life, would you be open to a conversation on speaking about how we would measure when we would be ready to do that, right? Yes. And then I've had other people say just straight up, no, I won't do it. And it's like, okay, I can understand, but I don't think I'm going to be the therapist for you. Because if you're telling me that I've got to tie one arm behind my back, then we're essentially going to get 50% of therapy. Mm-hmm. And that's...
Yeah. I was going to say, if that's known... If we have that known from the beginning, right? Like the housing thing, if I buy a house and it's a lemon, or the person who's doing the inspection is like, this is a really shitty foundation. Like you need to redo it or redo the electrical and the plumbing. If I am told that and I consent otherwise, meaning, no, I'm actually not going to follow your guidance that I hired you for. I'm going to forego that and then not do the electrical and plumbing, and please just build the rest of it as planned. I then also don't get to complain or not take accountability for my part of that when the things start leaking, when the chandelier's on the fritz. I also need to be able to go, oh, that's probably what they were talking about. And that kind of grace for self, or recognition of maybe I should have listened to this person's guidance that I was hiring
Mm-hmm.
for. There's a reason why typically people come in and they want an outside perspective. We are objective. We are supposed to be rather objective. What purpose does this serve clinically if I'm making these suggestions? If I don't know you yet and I am citing, we will likely talk about your childhood. That's not a personal attack on you. That's
Yeah.
the style of therapy I practice from. People know that from looking at my website. If that's not something you want to touch, I am fine with that. We are not going to be a good fit. And if you still want certain other pieces, then that other piece comes in of, I'm practicing as much as you're sharing with me. You don't also get to complain at the end that therapy wasn't successful if you're putting all these parameters or limits. I want a 6-pack, but I'm not willing to follow a macronutrient plan. I'm not willing to get 10,000 steps a day, and I won't drink a gallon of water. You're responsible for whatever results you get in any sense. Whether you're adherent or not, that is also part of the frame. I can offer you a frame. If you don't want it, or you nitpick it, or you're cherry picking rather, like, well, I want this, but not this, but this, but I want these outcomes and results, it's not going to happen, right? The carpenter, here is the blueprint that I'm giving you. You have to do the electrical and the plumbing if you want this outcome to last, like to have it or to last. Where that mutual accountability comes in. Is it the therapist's fault, or is it the therapy's fault, or is it I didn't take full accountability or do my homework or choose to agree to whatever contract I was given, especially in couples therapy? You and I deal with that all the time. Here are the rules of what you're allowed to do and not allowed to do, rules of engagement. I'll see you next week. Well, we did rules 1 through 5, but then we totally threw the baby out with the bathwater with the rest of it. And like, we'll be together if I won't stop screaming at them. Can you just teach me how we can do this without me having to change? Is sometimes what people come in with. Therapy is not supposed to enable bullshit.
No. Well, therapy is not supposed to be also weaponized against the significant other that needs to change, right? Like the perceived one that needs to...
Exactly, yes.
Like, oh, no. They're the identified patient. I'm the innocent one.
Can you look at them? Like, why are we ignoring their childhood? It's like, first of all, I'm not ignoring it. Second of all, it's a strategy. If they've told me I don't want to go there, I have to honor, we might need to your point, but I'm not going to go there right away, because then I lose the trust and the rapport, and I lose you both as a client, and then I can't help with anything, right? That's the art and science part of psychotherapy. So there's scope of practice, scope of competence. There is an art and a science to this job. There is data, and there's real life application and real life shit. That is however many thousands of hours we've sat with. That is the weaving in. Here's what the data says, but here's the reality of it. And that's a quality practitioner will share both. Here's what the theorist, here's what it looks like in practical, like in practice, right? Or in theory versus in practice. And the gap of everybody knows how to be in a relationship. You could read like a ChatGPT level or AI level, every relationship book and know it here. The reason why you don't embody it or imbue it, your own childhood gets in the way, your limiting beliefs get in the way, and your expectations and hopes of what it should be get in the way of you yourself applying practically what you know up here. That's where a therapist can come in and say, you know better, and not shaming them.
Absolutely.
Literally just talked about this last week, and you're coming in, thank you for being honest, still engaging in the pattern. What's going on? What's going on? You're right. I literally just can't kick this person, or I can't, I'm struggling so much.
Yep.
It's sometimes not a lack of practical knowledge.
Not at all.
It's an inability to apply what you know practically, because we get in our own way, and therapy is supposed to help us get out of our own way in many ways. That's what that's where I think a lot of the times people they either don't give it enough credence, or they put too much pressure on therapy. Well, now I'm in therapy an hour a week. Now I'm not a soothsayer. Like I'm.
Well, yeah. I know I'm really good at what I do. What I can promise you is that 3 sessions in, you're not going to be fixed.
No, there's 172, 76. I forget 170. I'm going to look it up. Hours in a week. I have it on my website. 168. Excuse me. I stand corrected on both counts. 168 hours in a week. You're coming to us. What are you doing with? That's what I put on my website. Yeah. What are you doing with the other 167 hours? 3 hours a month and we're supposed to change everything from tip to toe, your whole life, childhood to present day. Like, that's a lot of pressure to place on the
Oh,
frame.
yeah.
So we have to be honest with them as the therapist. Here's what we will cover. Here's the informed consent. Here are the boundaries and guidelines. If we are met with honesty and reality and
Okay.
like a goal, I think then we can collaborate rather than I'm loosey-goosey with my boundaries. I'm using it as a way to be codependent on the therapist side. The client comes in wanting this omniscient, omnipotent cure-all. That's probably the worst recipe for disaster,
Yeah.
is the poorly boundaried, highly codependent therapist on a mission to save everybody, and the client comes in and is like, my perfect healer, and puts it all on us. And that's where you have to ask yourself, is this for the client or is this for my own personal gain? We didn't really dive into that last time, but I'd love your perspective on just that filtration question as a therapist. If I have to ask myself, is this for me or is this for the client? Do you think that that's like a valuable question to ask?
Oh, absolutely. I think it's a valuable question. I was wondering which direction to go with it, because where I told you this before we started recording, which is I like to pay attention to the resistance that naturally occurs in me as a clinician. And so when I can start to feel that resistance build, here's something that I don't think anyone talks about, but we should talk about more, is if you're actually not looking forward to a certain client at a certain day on a certain hour, like, you actually need to let that client go. And the reason being is, if you're naturally coming into this space with a resistance that I don't like this person, how the heck are you supposed to hold unconditional positive regard for them and bless them in that? Now, I think there's a lot to process there. Transference is a real thing. Yes. Sometimes we can see that it's some of our own stuff that we have to work on. But if this is something that is a very consistent presenting issue, I find it fascinating when I hear clinicians try to push through that. Because if we are pushing through that, then we're not asking us the question of, like, is this for the client or is it for me? If it's for you to prove a point that you can work with alcoholics or this or that or whatever it is, again, you're almost using this person as a human guinea pig. And I think that that's unethical. It's not about what you can prove to yourself. It's your effectiveness with your client.
Yes. And I think in part, the one part I provide like an alternate perspective when I'm doing supervision, because they are in a spot where they are learning. Not that clients are guinea pigs ever, but you're like, out of all the times in your career that you're learning, that is the appropriate time to be like, oh, and I had an associate once years ago be like, well, I've never worked with teens and you gave me a referral for a teen off the wait list, so I'll just tell them I don't work with teens, right? And I'm like, no, you will not. You will be telling them what time you will be having it, and we will be working on supervision, because again, scope of practice, yes, you are allowed to see teens. Scope of competence needs to be built over time through exposure and practice. That does not mean if I've never seen a teen, I'm going to take the highest acuity. That's not what I'm saying. But run of the mill, quote unquote, depression, anxiety, phase of life, who am I? How do I fit in? Absolutely would be appropriate when under supervision, and being honest about that. I can try that out and develop my scope of competence and hone my scope of competence while I'm training. And that doesn't, to your point, not in violation of the ethical piece. If I can't work through it in consultation or supervision, to the transference point, if I don't like working with the client or something's coming up, my first duty is to seek consultation or seek supervision.
Correct.
What is it bringing up in me? What is coming up? Can I, when identified, can I and am I willing and able to work through that and still do my job? If it is a yes, wow, I didn't realize that brought up my own shit with my mom. Boom, my own personal therapy. Boom, my own. I'm back locked in. Yes, you can keep seeing the client. If it's to the point where you're like, I fundamentally do not agree, this goes against values, whatever else, under no circumstance would I ever want to work through this, that is the ethical thing to refer out. So just a little resistance or I don't like it, no, you can't just abandon your client and fire them. But if it's been a continual pattern that you've sought supervision and consultation and there is no resolve, and you've even addressed it with the client appropriately of like, hey, do you ever feel frustrated in our sessions? Because sometimes it's their emotion and not yours. If you've checked all that off the list, then yes, the appropriate and ethical thing to do is we can't work together anymore. I just wanted to add that, like, for new clinicians listening, because I know we have a few, and I send my supervisors these episodes sometimes of like, here's this topic, we talked about it. Just off the cuff, no, we're not going to be like, oh, it's not a good fit. Bye. How else are you going to know the scope of competence? Caveat, no, we're not using someone as a guinea or forcing it through just for the sake of, well, somebody said I had to. No, don't just dump them after the first ick. Try and sit through it and think if there's anything that you can change. And then if there is, do that. And if not, appropriately refer out. That's what I would add.
I think that's a mic drop right there.
Yeah. I think for anyone listening, if you have experienced these,
please,
any of this in your sessions, or if you're curious about it, please reach out to Adam or I. We would love to hear your perspective on things. And if you have ideas for other episodes,
absolutely,
to say, I'm still working on like our email address, like we're redoing on the back end, just for disclosure, we're redoing some of our marketing and our website. So it will be like have an idea for an episode, drop it here and it'll send to us. But in the meantime, we are both most active on Instagram. So you can DM either of us. I'm at Talia Bombola and Adam is at Wild Ethos Counseling.
There you go.
So let us know, and we'll be happy to dive in further to a topic and rate, review, and subscribe. It's how we stop ourselves from being the best kept secret, and we appreciate your listenership.
Thank you so much for listening. I also want to say, if you've been in that position like we talked about in this episode, where a therapeutic relationship came to a close, I hope that our episode today was able to provide you with some closure. That it is not necessarily all you. No. It's the fact that, hey, for where you were headed, what you had accomplished, that therapist was maybe no longer the best fellow traveler for you on that journey.
Yep. Yeah. Whether it's the clinical relationship or all the stuff in the frame, all those explanations of like, oh, I didn't know. Like, my final end note, there are rules of if they no-show or cancel or aren't adherent for 3 weeks, barring I'm out for surgery or whatever else, we have to close their file because it's not ethical or legal of us to keep them on our caseload if something happens and they list us as their therapist, but we're like, we haven't seen them in 5 months. Yikes, that's a nightmare when it comes to legal ethical. There are certain things that if you read in your contract with your therapist more thoroughly, maybe explain. And there are other times where it is clinical, you've reached your goals, your whatever else, termination for whatever reason, you can always ask for referrals. If we end it with you, we have to provide at least 3 referrals. And if you choose to end it with us, you're still more than welcome to ask. If you have anybody else, that you can think of, can you send me referrals? So it might be your journey in therapy with us as the guide, but it doesn't need to be the end of your journey in therapy at large in general.
Correct.
And if you've ever had a bad therapist, I apologize on behalf of our profession.
True.
That is not how we want it to look. I can say for Adam himself, we strive to have higher standards than probably what some people have experienced. So on behalf of all the good therapists, there are good therapists out there if you're willing to give it a try again.
We are out there and we are waiting.
Yes. Let us know how we can help, and we'll see you next time.
See you next time.
Thank you so much for listening to another episode of Between Two Clinicians. We would so appreciate if this episode resonated with you, for you to share it with somebody, and also find your favorite podcast platform and like, rate, and subscribe to the podcast. We would love to attract more listeners just like you and have this message be spread to whoever needs it. So thank you so much for listening, and we'll see you next time.